Dr. Sana, can you please show the consent form, please? Okay, go on.
Where am I starting from? Okay, so you've come today for your cesarean section. Do you understand what a C-section is all about?
Yeah, it's some procedure to deliver the baby.
Yes, that's correct. So what I'm going to do today is to explain to you what a C-section is, discuss with you the benefits of having a C-section, and then the risk of a C-section. Some of the risks might seem a bit too intense, but this is not to scare you. This is a conversation that we have on a daily basis with anyone having a C-section. Okay.
Okay.
Okay. So a C-section is a procedure where the baby is delivered via the abdomen compared to when you have a baby vaginally. Okay.
Okay.
So we'll make a cut on your tummy, a cut on your womb, deliver your baby, and deliver the placenta. After all of that is done, we'll stitch everything back up like it was before.
All right.
All right. Like with anything else, there are benefits and there are risks. So the benefits of having a C-section is to deliver your baby. It's rather a quick way and it's relatively safe as well. Okay.
Okay.
Yep. And moving on to the risks, but before that, do you have any questions about this?
No.
Okay. So the risks include risks that will immediate risks that will happen at the time of the C-section and risks that come later on. So I'll start with the immediate risk. There's a risk of pain. Once the anesthesia wears out, you will feel some pain. But this will give you some painkillers to help you cope with the pain. There's a small risk of infection, but we'll also give you antibiotics before the start of the procedure to minimize your chances of getting an infection.
Okay.
You will have some bleeding. Sometimes it's a lot of bleeding. Sorry, am I just doing this for general C-section or the
Or the
placenta previa in this case?
placenta
Sorry?
previa with Jehovah's Witness.
Oh, placenta previa, Jehovah's Witness. Okay, fine. So there's a risk of bleeding with any C-section, but particularly in your case, you've got a low-lying placenta, which may make the bleeding a bit more, okay? And also you are not keen to have any blood products. We'll discuss further about this, but yes, the bleeding will be a bit more. We will do everything we can in our capacity to try and control the bleeding, okay? There's lots of medications that we can give you to stop the bleeding as long as you've got no allergies. And usually the medicines alone are enough to stop the bleeding, but sometimes they don't work, and we might have to add on extra surgical steps that we may have to do, like putting in a balloon or putting in extra stitches. Okay.
Okay.
Sometimes also this may not work, and we might have to consider extra steps. And this may include taking out your womb, okay?
Oh, okay.
Which we call a hysterectomy.
Okay.
This is quite rare, but it may be a possibility if the bleeding doesn't stop. But it's important for you to realize that this is a last resort that we go. This is a last resort procedure, and it's only for life saving. So, and it's not an easy decision that we make when we have to take your womb out. It's done by two consultants who senior doctors would have agreed with each other that this is the only way to save your life. So it's a matter of choosing your life over your womb. Is this something that you'll be happy to have?
Okay. That's fine. Okay. I think it's fine for me.
Mm-hmm. Okay, so this is something that it's not that we are going to intend to do to take it out, but we might get to that point if we can't control the bleeding. Moving on, there's a small risk of getting blood clots in your legs, in your lungs. We'll give you some socks some socks that you wear in your legs before the procedure to minimize this risk. After the surgery is done, we will also do a risk scoring where we look at all your risk factors and see whether you need any blood thinning medications. afterwards, okay?
Okay.
There's a small risk also of injury to the organs in your tummy that are lying close to your womb, like your bowels, the intestines, your bladder, the urine bag, the ureters, which are the tubes that run from your kidneys to your bladder, and there are some major blood vessels as well. And this risk is also quite small. But if it happens, we may have to involve our colleagues who are specialized in treating or repairing those injuries to come in, and we'll let you know afterwards.
Okay.
There's a small risk of the baby getting a cut during C-section. It's also a very small risk. In about 100 C-sections, maybe just 1 to 2 babies may end up with a cut, but it's a very small, shallow cut that will heal without anything further. Any questions so far?
No, doctor, but what if I bleed heavily and I'm not going to accept blood? So anything else
Yeah,
that can
so
be done for me?
yes. So, if you bleed heavily, we're going to make sure, as I've said before, we're going to make sure we've all the medications. We've got an experienced doctor able to deal with the bleeding. But if we feel like we're also going to use what we call a cell salvage or a cell saver, where we will collect your blood, we will purify it and give it back to you if you're okay with that. Okay?
Okay.
We can also use the interventional radiologists who are our colleague doctors who can use some of their special equipment to try and block your blood vessels, cut out the blood supply that causes the bleeding. Yeah.
Yeah, okay.
Okay, so I want to reassure you that we'll try and make the surgery as safe as possible. We'll try everything within our capacity to make it safe for you.
Okay.
Okay. And then just lastly, it's also important to know that there's a risk in future pregnancies when you've had a previous C-section, like getting a low-lying placenta like you've had now, which can cause bleeding during pregnancy and bleeding afterwards. But we will make things in place so that you're followed up really well in the event that this happens. There's a risk of I've forgotten whether you've got 2 C-sections or it's your first one. But anyway, is it 2 or 1?
The 2 previous cesarean section. Now this is third one.
Okay, fine. So for you, we will not encourage you to have a vaginal birth. So yeah, um, so yeah. But in the event this was your first C-section, you would be able to have a vaginal birth, and it's important to realize that you can have what we call a scar rupture, where your cesarean section can open up during labor next time, and this can be potentially a serious condition to you and your baby.
Okay. Thank you.
Complete the consent process. How you're gonna
Okay.
end it?
Okay. So do you have any questions?
No.
Okay, so I forgot to say that this C-section is normally done under spinal anesthesia, where you will have an injection in your back to numb you from the top of your tummy to your feet. But our colleague, the sleep doctors, the anesthetist, will come and have a chat with you about that. We've talked about the risks, and you're happy for us to do a cell salvage, interventional radiology. So what you need now is to read the statement of the patient. And if you're happy, we'll just tick that you're happy to have regional anesthesia. I will sign my name and put a date, and I'll ask you to also sign to make sure that you're happy.
Okay. Okay, Dr. Abya and everyone, I would like to see this form. So how we started generally is that name of the procedure or any course of treatment. So for example, in this case, it is cesarean section for the placenta previa, right? And then you have to explain that why, because having the vaginal birth, there's increased chances of bleeding. So intended benefit is owing to the position of the placenta, the risk of vaginal delivery are greater than those of the cesarean section, and delivering the baby via cut on the tummy and move avoids the risk. So we have to go. So this is the reason we are going. So this is the intended benefit. You can just pick up those forms in front of you and be smart in that way. And then there are first few risks that I want you to be aware of. This is not to scare you. There are frequent risks and there are serious risks. So the frequent risks or the common risks are the ones that may occur immediately after the surgery. Usually the wound discomfort, pain, and maybe readmission to the hospital, spinal cut to the baby, and sometimes even the infections requiring antibiotics, and the both you or your baby may need admission, and also a risk of blood transfusion. But as she is your witness and she is not accepting, so you have to tell her about the serious risk. The serious risk of 1100 of hysterectomy, but in your case, it may be higher because she had previous 2 cesarean sections. The risk of acquiring blood transfusion, risk of needing further surgery, risk of repair of damage to the other structures, injury to the urinary system or bowel or bladder, and then increased risk of tear in the future pregnancies in the womb, and stillbirth in the future pregnancies. In future pregnancy, placenta may even go further up to the Accreta. It may be also previa. And the risk for all the cesarean section overall, which is very uncommon, the risk of very rare, the risk of death. So you have to tell. It's not trying to scare. I'm not trying to scare you. It's just the information that I want you to be fully informed. And then you see there is another this heading of extra procedures that include cell salvage, as she's not accepting blood, so we may have to offer you cell salvage and we will keep it prepared. Would you accept it where your own blood is filtered back to you, filtered and transfused back to you? And then the interventional radiology, where certain substances are injected in the vessel supplying the womb, and so in order to reduce the blood loss and control the bleeding. And then you can say that I have, there are, generally it is done under general spinal anesthesia, but the anesthetist will have a discussion with you as well. And then you hear the sign of the patient, name, date of birth. You can start with this thing. You can start that I will be putting your name and NHS number, your date of birth, and I'm putting my name, NHS number, oh sorry, my name and date, and I will be signing at the end of it. And you see at the very end there is top copy accepted by the patient. So you have to offer one copy to the patient in case she wants to withdraw any her consent. She can do that at any point of time, right, before the surgery. Okay, so these consent forms will be available. You don't need to struggle much about it, but yeah, you need to tell about what are the steps of the consent. You need to know about them, so you are free. You are quite. You don't struggle there, right?